All right, let's jump straight into today's explainer. Imagine, just for a second, that you are the CEO of global public health. You're tasked with fixing a system that feels like it's literally bursting at the seams. So you decide to sit down with an advanced artificial intelligence to map out a strategy. That's exactly the fascinating premise we're exploring today. What actually happens when someone poses as a high-level health executive and runs a strategic consultation with an AI to solve our global health crisis? Well, as you're about to see, the results are incredibly revealing.
So right out of the gate, the CEO hits the AI with a massive foundational question. What is the main population health challenge in modern times? It's the perfect starting point, right? Because before you can prescribe a cure, you have to accurately diagnose the disease. If you were stepping into the shoes of a global health executive, where would you even begin?
Now, you might expect a simple answer, but the AI's initial response is actually super nuanced. It basically says that picking just one single major threat isn't really possible. It depends entirely on your focus. Are we talking about the raw burden of disease, the underlying risk factors, or maybe emerging systemic threats? It tells us right away that the global health crisis isn't just one giant monster hiding under the bed. It's a really complex web of overlapping issues. But when it comes to the sheer volume of mortality, the AI quickly zeroes in on a clear frontrunner.
And what is truly shocking here is the massive scale of the problem. The AI points out that non-communicable diseases, or NCDs, account for over 70% of all global deaths every single year. That's a staggering majority. We're not talking about infections you catch from a virus here. These are chronic, long-term conditions. They represent the absolute primary burden weighing down health systems worldwide today.
So what's actually driving that massive 70% chunk? Well, the AI identifies demographic aging, urban lifestyles, and metabolic changes as the core drivers. It highlights cardiovascular diseases like heart disease and strokes as the undisputed leading cause of global mortality. It also points to rapidly rising rates of type 2 diabetes, along with cancers and chronic respiratory illnesses. The big takeaway here? Our modern, urbanized, highly sedentary lifestyles are literally fueling the primary threats to our survival.
But wait, the AI doesn't stop at physical diseases. It introduces this really important concept of multipliers. Think of environmental degradation like air pollution, which causes millions of premature deaths on its own. Then we have biological vulnerabilities like antimicrobial resistance, or AMR, which is absolutely terrifying because it's making our standard treatments totally ineffective. Add to that the constant threat of new zoonotic pathogens, plus the massive, often ignored burden of mental health disorders and social inequities. These things don't just exist in a vacuum, they act like gasoline on a fire, dangerously multiplying the deadliness of the NCDs we just talked about.
Okay, having established this incredibly daunting diagnosis, the narrative shifts. The CEO pushes the AI again, moving this consultation from diagnosing the problem to demanding an actionable prescription. As a CEO of public health, I ask you what I should do to address these issues. This is where we get to the really good stuff. How do we actually fix a broken world?
The AI comes right back with a concise three-step executive agenda. It advises a massive, fundamental shift away from reactive medical treatment and toward proactive, systemic prevention. The three steps are: pivot to upstream and health capital investment, integrate environmental and health systems, and modernize data and surveillance systems. Let's break these down one by one because this roadmap is totally fascinating.
Step 1 is a total game changer. The AI introduces this critical concept called health capital. Honestly, this is a huge aha moment in the consultation. The AI argues we need to focus our policies and our budgets on building a cumulative stock of physical, mental, and social resilience early in life. We've got to stop seeing health as just a deficit we try to avoid at the end of our lives and start treating it as wealth, as literal capital that we actively invest in and build up from childhood.
So how do we actually build that health capital? The AI recommends going upstream. Instead of waiting for someone to get sick, we go right to the source. This means addressing psychosocial determinants, like rolling out policies to reduce social deprivation and chronic stress, which actually act as biological amplifiers for disease. It also means pulling some major economic levers, taxing ultra-processed foods and tobacco while actively subsidizing nutrient-dense, locally sourced foods. It's all about engineering our society so that the healthy choice becomes the default choice.
Moving on to step 2, the AI tells us we've got to break down the silos. Human health is directly tied to our environment, so it suggests partnering with urban planners to lower air pollution and design walkable, bikeable cities. Furthermore, it pushes a One Health framework. This basically means coordinating human, animal, and environmental surveillance to monitor spillover risks and mitigate that antimicrobial resistance we talked about. Because true health isn't just what happens in a hospital bed, it's what happens on our streets and in our agriculture.
Then we hit step 3, which is all about data and delivery. The AI suggests using population-level health data and predictive risk analytics to actually foresee NCD spikes before a crisis even escalates. Imagine knowing exactly where a diabetes spike is going to happen before it completely overwhelms the local clinic. Alongside this, it recommends decentralizing care, using community health networks to make early detection and lifestyle support accessible, and, crucially, culturally adapted to local vulnerable populations.
All right, but let's be real for a second. Any good CEO knows that a grand vision is totally useless without a budget. So, the CEO asks the ultimate practical question: how do we balance funding? Shifting resources away from immediate, life-saving emergency care toward long-term prevention faces massive political and financial resistance. Clinical outcomes save lives today, while preventive gains compound over decades. So how do we actually pay for this revolution?
The AI comes back with a really clever three-pronged financial playbook. First, resource reallocation frameworks, which essentially means ring-fencing a slowly growing percentage of the annual budget strictly for prevention. Second, cross-sector cost sharing. Think about it. If a new bike lane improves health, the urban planning department and the health department should just co-fund it. And finally, to survive the political game, demonstrating short-term ROI. By prioritizing things like early risk screening and workplace wellness, leaders can prove immediate, tangible returns to build momentum for those bigger, long-term investments.
Section 15. A new health paradigm. Preventative versus biomedical.
This brings us to the real philosophical climax of this whole consultation, illustrating a complete paradigm shift. Right now, our prevailing biomedical model defines health strictly as the absence of disease. The AI calls this health as zero. Basically, you're either sick or you are at zero. But the preventative model defines health as a positive, cumulative stock of resilience. This is health as an asset. It's a fundamental reframing of how we view human well-being over an entire lifespan.
And this shift totally changes who and what we're targeting. The biomedical target is the individual patient diagnosing cellular or organ breakdown only after the symptoms have already appeared. It is entirely reactive. The preventative target, on the other hand, focuses on populations. It goes after the structural determinants, the living conditions, the chronic stress, the social deprivation that actually cause the disease in the first place. It moves the locus of control away from doctors with high-tech tools straight into communities, schools, and city planning. When you put them side by side like this, the contrast is literally night and day. The primary goal completely shifts from damage limitation to health asset accumulation. The whole paradigm goes from being reactive and episodic to proactive and continuous. But look closely at that bottom row, systemic cost. The traditional biomedical model is hyperinflationary. It's this constantly escalating financial nightmare because advanced end-stage clinical care is so incredibly expensive. The preventative framework offers a high initial return on investment by significantly shrinking that long-term burden.
Now, let's be absolutely clear here, because the AI makes a really important distinction. We are not abandoning the old model entirely. If you break your leg or have a sudden heart attack, the biomedical model is exactly what you want. It absolutely excels at acute care and emergencies. However, it is fundamentally unequipped to curb this modern tide of non-communicable diseases. Because these chronic diseases are driven by lifelong exposures, applying a purely biomedical lens just leads to escalating costs with diminishing returns. We're just treating the symptoms, not the cause.
Which leads us to what is arguably the AI's most profound thought of the entire session. Rebalancing public health strategy requires treating medical care as a safety net rather than the primary mechanism for generating societal health. Just let that sink in. True health generation doesn't happen inside the four walls of a hospital. It happens in our neighborhoods, in our schools, in our food systems, and in our daily lives. Medical care should be the net that catches us if we fall, not the engine we rely on to keep us moving.
So, as we wrap up this AI consultation, we're left with a really critical reflection. We've seen the data, we've seen that massive 70% burden of chronic diseases, and we've explored the AI strategy to pivot from reactive treatment to proactive health capital. So, I leave you with this final, provocative thought based on everything we've unpacked today. Is our current healthcare system stubbornly built for the past, or is it genuinely ready to build the health capital of the future?